Hi, everybody. Thanks for watching. I want to start off by saying that I do not have borderline personality disorder. I've just been trying really hard to learn as much as I can about it. And I know how important it is to find the right treatment. And um, I know a lot of people struggle to do that. So I just want to share the information that I have found. I want to mention that I'm not a medical professional. I'm not giving medical advice. There are probably medical professionals and people with borderline personality who can speak a lot better on this than I can. But I still just want to share the resources that are out there in case it's helpful to anybody. I know finding good help can be a struggle, even for people who have anxiety or anything else. So um, I really like using NAMI to learn as a starting point. It's the National Alliance on Mental Illness, or NAMI.org. And you can find out about different treatments for different things by searching on here if it wants to cooperate. I don't know why the search. There we go. So if you click on their BPD article, you can scroll down and see what the treatments are. So examples of treatment include psychotherapy, medications, group, peer, and family support. So there's no, it mentions there's no medication specifically made to treat the core symptoms. But there's some things that can help some people, like mood stabilizers, antidepressants. The therapy, though, is a type of therapy called DBT or CBT. And DBT seems like the most common recommended from what I've read. And there's a lot of therapists who say that they do DBT, but it's not real DBT. There's another video I'm going to link to. It's not mine, but it talks about DBT, and DBT is like a combination of individual therapy once a week plus group therapy once a week plus a 24/7 number you can call during emergencies or when you really just need like some kind of intervention. And also your therapist is required to have a therapist. I'm also going to link to, there is a organization, borderline personality disorder.org, or NEABPD, which stands for the National Education Alliance for Borderline Personality Disorder. For loved ones, there is a course you can take if you go to families and then the Family Connections program. There's an online course. It's 12 weeks. There is a waiting list, but that can be helpful for loved ones. There's the application there at the bottom. I'm also going to link to, there's a bunch of videos in their course that are just available on YouTube. So I'll link to that playlist also. So back to the DBT. A lot of the people that I've talked to have a really hard time getting into therapy because they don't have insurance and they assume that they can't get it. I know that every state is different, but don't assume that you can't get insurance. I know that it's possible to actually get free insurance and then get free therapy with that insurance, depending on your income level and other things, and your state. But just don't assume. The place that you would go to get health insurance would be healthcare.gov, and it's the Medicaid that can be free, depending on your income level. So you would just go to healthcare.gov. That's where you would start. It's probably going to take you to a different portal. I think every state's different. So some you go straight through healthcare.gov. Some they're going to redirect you. They're going to redirect you to wherever you'd go to go through your state. So you would just see if I can enroll right there. And yeah, so you would apply for your health insurance, and that's going to help find therapy. Medicare, I think, is the one people assume that Medicaid is for elderly people. That's Medicare. Medicaid is for anyone. So definitely look into that. And then as far as finding a therapist, the person who founded DBT therapy, it stands for dialectical behavior therapy, is Marsha Linehan. I'm pretty sure she actually has borderline personality. And she has resources on her website for finding therapists. So you would go to resources and then find a therapist. And her website, by the way, is behavioraltech.org. And that's going to take you to the directory. Okay, and then you would select your continent. Let's use, let's go to US. And then let's go for maybe North Carolina. Okay, so if you have Medicaid, a lot of these therapists probably are not going to take it, but it's worth asking. If you have, standard regular insurance, there's a good chance they'll take it. If you don't have the right insurance or can't afford their out-of-pocket costs, a lot of therapists will offer a sliding scale. So their prices will change depending on your income level. So that's worth asking too. So my strategy, which might be a little bit crazy, but what I did to find a place was I copied and pasted all of these emails into the BCC section of my email. So they can't see that I'm like mass emailing. But yeah, so I just BCC'd every single one of these emails, asked them what kind of insurance they take, asked them if they don't take that insurance, what the out-of-pocket cost is, and asked them if they have a sliding scale available. Because a lot of the times they're not taking new patients and stuff like that. So it would take, like, usually I think the number of people who are going to respond is pretty slim. And then they're going to say that they're not taking new patients and things like that. So that's why I just do the mass email strategy. And those are the 3 questions: what type of insurance they take, what the out-of-pocket cost would be if they don't accept insurance, and then if they have a sliding scale available. Okay. Another thing you could try is Psychology Today has a Find a Therapist. Say, just pick a zip code here. So you can put in your zip code, then you can select insurance. Just say Blue Cross Blue Shield. We'll say this is where you would select DBT therapy here. But a lot of therapists, again, say they offer DBT, but they don't. So it's, it's a starting point, but you want to really ask what their experience with DBT is. And there's more filters. You can search for the ages they treat. You can search for the what gender they are, what types of things you need treatment for. So it's a place to start, but you'd probably want to ask them more questions. Some therapists will also do like a free introductory session to see if you're a good fit. So that's something else that you could ask for also. Something else is if you look at the symptom of emotional dysregulation, it's not always diagnosed as BPD. Sometimes there's trauma components to it. And if there's a PTSD component, there's other treatments for PTSD, which I've just heard people say are helpful. This isn't listed as a treatment for BPD that I know of. I've just heard of people in those circles talking about these other kinds of therapies, so I'm just going to mention them. And these are treatments for trauma that don't really require you to really get deep into talking about it. From what I know, I could be wrong on that, but it's supposed to be kind of a gentle way to process it. One is EMDR therapy. That's something else on the Psychology Today. You can look for EMDR, I believe. Yeah. Which stands for eye movement desensitization reprocessing. And it uses your eye movements to kind of work through the trauma, help you. It helps you on a neurological level, I think somehow. I'm not really educated on the science of it. But there's this organization, emdria.org, and they have a link for finding an EMDR therapist. There's a directory here. You can search for EMDR therapists. Another type of therapy I've heard about, I think it's similar. Again, I don't know a lot about it, but it's called accelerated resolution therapy. And there's also an organization for that, arttherapyinternational.org. And again, they have lists of therapists here. Find a therapist for that. I don't know if Psychology Today has a filter for that. It doesn't look like they do. But yeah, so you can put in your state and your city and find art therapists too. I just know I've heard of people turning to this when DBT doesn't help. And again, that might be a different diagnosis. I know it still has to do with emotional dysregulation. So yeah, please don't take my advice as medical advice. These are just resources that I think more people should know about. So I'm going to link all of these in the description. And if you have better knowledge than me, please leave a comment. I think a lot of people learn a lot just from comments. So yeah, I hope this stuff's helpful. I'm just doing my best to get this stuff out there. There's so much to learn and so much to know and so many ways to get it wrong. So yeah, just trying to help. Thanks, and yeah, take care.